Good morning. It's January 29th, and this is your daily brief in science. Here's everything you need to know. AlphaGenome, Google DeepMind's new regulatory genome AI tool, aims to predict how DNA mutations affect biological processes and disease, potentially accelerating medicine discovery. It's trained on extensive public datasets measuring non-coding DNA across hundreds of human and mouse cell types, and is open for non-commercial research use by about 3,000 scientists in 160 countries. The model analyzes sequences up to 1 million base pairs, predicting how each nucleotide pair influences cellular processes, from gene start and stop points to RNA production, delivering higher resolution than many prior models. Experts urge cautious interpretation and note the need for further verification of the claims. Researchers acknowledge ongoing work to sharpen predictive power and quantify uncertainty in the results. Feedback from researchers, including Stanford scientists, is optimistic, with expectations that AlphaGenome could impact clinical workflows and pharmaceutical research. Key validations include predicting cancer-driving mutations and helping interpret variants from large sequencing studies, though accuracy varies by long-range regulatory elements and tissue context. Future work focuses on improving long-distance gene regulation predictions, tissue specificity, and cross-cell type accuracy, such as neurons versus heart cells. AlphaGenome uses a two-stage training approach and delivers fast, robust predictions, under a second per variant on high-end GPUs, through a distilled student model learning from an ensemble of teachers. Architecturally, it combines a convolutional base pair analyzer, transformers for refinement, and a final network that outputs molecular property predictions. DeepMind and collaborators frame AlphaGenome as a research tool for genome-wide association studies and cancer research, stressing cautious interpretation and need for validation. Two big findings frame today's science news. Evening type or night owl individuals show poorer cardiovascular health and a 16% higher risk of heart attack and stroke than intermediate chronotypes, based on a study of more than 320,000 British adults aged 39 to 74. Researchers used LE8 factors to assess heart health, looking at 4 behaviors: diet quality, physical activity, sleep duration, nicotine exposure, and 4 health factors: blood pressure, body mass index, blood sugar, and blood lipids. Public health guidance suggests prevention should focus on nighttime sleepers improving lifestyle habits, including sleep regularity, quitting smoking, optimizing light exposure and meal timing, and making small increases in physical activity when full changes aren't feasible. The study, published in the Journal of the American Heart Association, notes that while the associations are modest and observational, they suggest that circadian misalignment may influence risk through behavioral pathways rather than biology alone. Experts caution that absolute risk varies by population and that the sample has limitations, including a predominantly white, middle-aged to older UK biobank cohort and chronotype data that were self-reported at a single point in time. Commentators like Kristen Knutson and Sonia Talani discuss internal versus social clocks and advocate practical, incremental lifestyle changes that can be adopted without a complete life overhaul. The article notes that findings align with the American Heart Association's emphasis on sleep quality and duration as key to cardiovascular health, alongside diet and activity. It also highlights that the research received partial funding from the American Heart Association, and the authors call for more studies, including genetic and sex-specific factors, to better understand who is most at risk and why. The story ends by inviting readers to subscribe to Scientific American for ongoing science journalism coverage and deeper dives into how sleep intersects with health. 2 Canadian clinical trials published in Nature Medicine show that fecal microbiota transplants can reduce immunotherapy toxicities and improve response rates in cancer treatment. The research spans multiple institutions, including Lawson Health Research Institute, London Health Sciences Centre, CARCHM, and CHUM, with collaboration between sites in London and Montreal. A Phase 1 trial at London Health Sciences Centre and Lawson Research Institute found customized FMT is safe when combined with immunotherapy for advanced kidney cancer, involving 20 patients. The study notes the use of LND-101 fecal transplant capsules and discusses efforts to scale production to widen access. Funding for the kidney cancer trial comes from a mix of sources including the Ontario Institute of Cancer Research, CIHR, AMOSO, Western University, donors and foundations. The lung and melanoma trial was funded by the Canadian Cancer Society. Key researchers cited include Saman Maleki at LHSCRI, Dr. Ariel Elkreef and Dr. Rahima Jamal at CRCHUM, among others, who point to reduced toxicity and improved outcomes. A broader team includes Maleki, Elkreef, Jamal, Dr. Michael Silverman, Dr. Ricardo Fernandez, and Bainam Jabarizadeh, with support from multiple foundations and Canadian funding bodies. Researchers emphasize donor selection and personalized approaches, noting that different donors' microbiomes may influence outcomes depending on the cancer therapy used. The studies discuss donor screening and the potential to tailor FMT to individual patients and cancer types. Public communications feature English and French video interviews and provide contact information for further inquiries. These trials build on prior melanoma work and expand exploration to pancreatic and triple-negative breast cancers, aiming to broaden immunotherapy options for lung, melanoma, and kidney cancers. The research team continues to highlight the potential to scale FMT capsules for wider use and to improve both safety and efficacy in cancer treatment. A team using the James Webb Space Telescope has identified MOMZ14, a galaxy that dates to about 13.5 billion years ago at a redshift of 14.44, roughly pushing the observable edge of the early universe. The finding shows MOMZ14 about 100 times brighter than pre-launch models predicted for galaxies at such an early time. Webb continues to extend its legacy of pushing back cosmic boundaries, following prior confirmations like GNZ11 and highlighting a growing gap between theoretical predictions and observations in the infant universe. MOMZ14 adds to a pattern of unexpectedly luminous early galaxies, underscoring a mismatch between theory and observation in the universe's first hundreds of millions of years. Researchers including Rohan Naidu, Pascal Oesch, Jacob Shen, and Yijia Li stress the excitement and the many questions remaining about how the earliest galaxies formed and contributed to reionization. The discovery underscores international collaboration among NASA, ESA, and CSA, with NIRS-ECT and related instruments playing central roles. Webb's mission maps the early universe and guides future missions and theories as more distant galaxies are observed. Cosmological redshift measures light travel distance in an expanding universe, with reionization providing crucial context for these early epochs. MOMZ14's age and properties were determined using JWST's near-infrared spectrograph, which traces how the galaxy's light shifts over vast distances. Spectroscopic confirmation via NIRS-ECT is essential for precise distance and timing, reinforcing the need for follow-up observations beyond imaging. The study emphasizes that spectroscopy is crucial to accurately determine redshift and epoch, validating MOMZ14's distant nature beyond photometric estimates. In particular, JWST's NIRS-ECT confirmed MOMZ14's redshift and timing, solidifying its status as a very distant galaxy, and NASA notes that this record could be surpassed as observations improve, reflecting the evolving and uncertain nature of measuring cosmic distances. A new kind of power source could power biomedical devices and soft robots without external supports. Penn State researchers have developed non-toxic, flexible hydrogel-based batteries inspired by electric eels, delivering high power density and environmental stability. The approach uses all hydrogel flexible cells that are non-toxic and biologically stable, suited for medical devices and soft robotics. They solved fabrication challenges by chemically tuning the system to ensure uniform spreading, mechanical stability, and low resistance on spinning surfaces. The team built a 4-layer hydrogel stack, about 20 micrometers per layer, applied via spin coating to minimize internal resistance and boost output. This ultra-thin multi-layer architecture yields higher power density than prior designs by reducing internal resistance. Spin-coated nano-thin layers preserve flexibility and biocompatibility while enhancing overall performance. The study, published in Advanced Science and supported by the Air Force Office of Scientific Research, notes that glycerol enables operation at temperatures as low as -80 degrees Celsius and helps keep the hydrogel hydrated for days in air, extending durability. The researchers claim this is the first fully hydrogel-contained power source that needs no external structural support while delivering high power densities and environmental robustness. Future work aims to push higher power density, improve recharge efficiency, and explore potential self-charging capabilities with broader biomedical and wearable applications. The devices achieve power densities around 44 kilowatts per cubic meter, outperforming earlier hydrogel devices and suitable for implanted sensors, soft robotics controllers, and wearables. Overall, the hydrogel-only power sources are designed to be safe for biomedical environments, operating without mechanical supports and within biological contexts. This has been your Daily Brief in Science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. Tune in tomorrow. We'll be back with everything you need to know.